All right, welcome to the Explainer. Today we're jumping into a really serious medical emergency, acute heart failure. Just imagine the body's most vital pump suddenly failing. It's an absolute crisis that demands immediate, life-saving action. So we're going to break down what triggers this, how doctors diagnose it, and the critical steps they take to manage it.
Okay, to really get a sense of the scale here, just look at this number. Over 1 million hospitalizations for heart failure in the US alone, every single year. This is not some rare disease, folks. It's a major public health challenge that doctors and nurses are battling on the front lines day in and day out.
So, what's actually going on inside the body during this crisis? Well, at its core, acute heart failure is just a sudden, really dramatic drop in the heart's ability to pump blood. But, the term itself can be a little tricky because not all cases kick off the same way. Let's dig into a really key distinction.
Yeah, it's super important to understand there are basically two main scenarios here. First, you've got true acute heart failure, AHF for short. Think of this like a sudden, unexpected engine failure, a massive heart attack, a major trauma, something that just causes the whole system to crash. Then there's acute heart failure syndrome, or AHFS. This is more like a slow leak that suddenly bursts. It's usually a worsening of a chronic, long-term condition that gets pushed over the edge by something like an infection or high blood pressure. Both are absolute emergencies, but knowing the cause, that's key to treatment.
Now, when a crisis like this hits, the body doesn't go down without a fight. It sends out some very clear warning signs. The real challenge for both the person experiencing it and the doctor is to decode these signals before it's too late. So what are we looking for?
So how does the body actually send out this SOS signal? Well, the clues come in two different forms. There are the things a person feels internally, and then there are the things a doctor can actually see and measure externally.
And this is really where the medical detective story comes together. On one side, you've got the symptoms. That's what the person is actually feeling. We're talking about a crushing shortness of breath, what doctors call dyspnea, or just extreme, overwhelming fatigue. On the other side, you have the signs. These are the clues a doctor can physically observe. That could be a racing heart or tachycardia, and even fluid in the lungs that creates this crackling sound called rales. You put the patient's story together with the doctor's findings, and that's how you start to get a clear picture.
So, with all these clues in hand, the medical team kicks its investigation into high gear. They need to confirm what's going on, and they need to do it fast, and they have a very specific set of tools to get it done.
You can think of the diagnostic process like building a legal case, piece by piece. First up, blood tests. They're looking for chemical clues. Markers like BNP, which basically screams heart stress, and troponins, which point to actual muscle damage. Next, they'll do a chest x-ray. This gives them a quick snapshot of the chest, and it can reveal things like fluid in the lungs. But the real clincher, the most critical piece of evidence, comes from the echocardiogram. This is an ultrasound that lets doctors literally see the heart in motion, showing them exactly how well or, how poorly it's actually pumping.
Okay, once that diagnosis is confirmed, the clock is absolutely ticking. The emergency response is all about one thing: stabilizing the patient and supporting that failing heart right now.
The immediate game plan has 4 main goals. First, you've got to reduce the preload. That's all the fluid coming back to the heart. Think of it like turning down the faucet. Second, you reduce the afterload by relaxing the blood vessels, which makes it easier for the heart to pump blood out. Third, you want to improve the heart's contractility, literally make each squeeze stronger. And finally, of course, you have to maintain oxygen levels. So let's look at how the meds help do all that.
So, to deal with all that fluid overload, the first tool out of the box is usually diuretics. Imagine the body as a flooded basement. Diuretics are like the sump pump. They tell the kidneys to start getting rid of excess salt and water, which lowers the overall fluid volume and just takes a massive burden off the struggling heart.
Next up, to ease the heart's total workload, doctors turn to nitrates. These are what you call vasodilators, which is just a fancy way of saying they widen the blood vessels. This does two amazing things at once. It reduces the pressure of the blood coming in, and it lowers the resistance of the blood going out. It's basically like making the pipes bigger on both sides of the pump, which makes its job way, way easier.
But what happens if the heart muscle itself is just too weak to pump effectively? Well, in the most severe cases, that's when doctors bring out the big guns, inotropes. These are powerful drugs that act like a direct jolt to the heart muscle, forcing it to contract more strongly. It's a critical but temporary boost, just to keep blood moving when the heart is right on the verge of giving out.
Surviving that initial crisis, that's the first huge hurdle. But for patients with acute heart failure, let me tell you, the journey is far from over. What does life even look like after they leave the hospital?
And the statistics here, they're pretty sobering. While the immediate survival rate in the hospital is actually quite high, the danger does not end when you walk out the door. Just look at this jump. Within only 6 months, the mortality rate can climb as high as 25%. It's a really stark reminder that the acute crisis is often just a symptom of a much bigger ongoing problem.
So what is the path forward? Well, long-term survival really depends on a whole new, proactive strategy. This means getting super aggressive about treating the root causes, whether that's high blood pressure or blocked arteries. It means making major lifestyle changes, like seriously cutting back on salt. And, maybe most critically, it means sticking to a very precise medication plan, every single day, to protect and support that heart.
You know, there's a saying that the true challenge begins after the crisis ends. And in this case, it's absolutely true. The heroic work in the emergency room is just step one. The real, long-term battle is managing this chronic condition day in and day out to prevent the next crisis from ever happening in the first place.
And that really brings us to the ultimate question, doesn't it? When you have nearly 1 in 4 patients landing right back in the hospital within just a few months, we have to ask ourselves, how can we do better? How do we move beyond just putting out fires and start truly protecting these vulnerable hearts for the long haul? Finding the answer to that is really the future of cardiac care. Thanks for watching.